Hello, I'm Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Pet Pune. Today, let us talk about the advent of genetic technology in IVF that helps us to detect chromosomal disorders in the embryos. Now, whenever we make babies artificially with the help of IVF or ICSI technology, the most common question that the patient and her relatives ask us is, Doctor, will there be any kind of abnormalities in our child? Will the baby be mentally or physically as normal as a naturally conceived child? Or are there any tests which are available to identify whether the baby which we have inserted is genetically normal or not? And the answer to this is the advent of the recent most technology in genetic sciences, which is known as PGTA or PGS PGD. Now, this pre-implantation genetic testing is mandatory in a few countries, but in our country it is optional. It is generally subjected to patients with very advanced age, like the mother's age is more than 35 years, if there is any problem with the growth of the embryo, if it is a slow growing embryo or asynchronous, that is one cell big, one cell small, and supposedly or seemingly slightly abnormal looking embryos can all be subjected with consent and with legalities for a PGTA testing. Now, this pre-implantic genetic testing is basically for mainly three main chromosomes, 13, 18 and 21. Chromosome number 21, if affected, causes Down syndrome, which is of a very big concern because it causes mental retardation apart from other physical abnormalities. So all in all, if we want to know whether the embryo which we have formed is genetically normal or not, these technologies can be resorted to, which will help us get a chromosomal mapping of our child, and it will also help us to know which baby of the given embryos is chromosomally abnormal. So before transferring the baby, this PGTA testing has to be done once your embryo is formed to a blastocyst stage. At the blastocyst stage, the biopsy of the baby is taken and it is sent to genetic labs with due consents for abnormality testing. Now, suppose we send 5 embryos, of which 2 embryos come aneuploid or abnormal. These 2 embryos are discarded and the normal chromosome embryos, which are the euploid embryos, are transferred into the womb of the mother subsequently by frozen embryo transfer. So this technology is definitely a boon to patients who have had abnormal babies in the past or who might have an abnormal child due to certain additional factors, and the genetic technology is a breakthrough as it helps us to identify major chromosomal abnormalities before the baby is born, and hence, in fact, in this case, before we even embryo transplant the baby, we can get to know about the normalcy of the chromosomes. Thank you.